Hi, my name is Emma and I work for Save the Children. Within the READY project, my role is a senior health advisor to support the key technical sectors and cross-cutting team experts. I provided technical input to this framework in the early formation of this document. Alice, I understand you're a regional health advisor working with Save the Children, supporting East and Southern Africa, and you've been providing support to health programs responding to the COVID-19 outbreaks in the community. We'd like to ask you about your recent experience of COVID-19 programming. Your organization decided to respond to the COVID-19 pandemic by supporting community-based services in a humanitarian setting. Specifically, you provided support to people that are in isolation or quarantine at household level. Alice, can you tell us how this integrated framework can help you?
The framework includes important tips for integration and adaptation that is needed in order to offer services during COVID-19. For example, when the community health workers visit residential settings to attend to patients in isolation and quarantine during COVID-19, they will have a number of tasks to carry out, such as evaluating the home setting for physical health concerns, monitoring the patient, such as by taking the temperature and monitoring symptoms. They also evaluate the COVID-19 patient to see whether they are fit to be cared for at home. For example, if they are effective in using their masks and other protective measures, or how far they live from a health facility in the event of deterioration in health status. Whilst there, the framework will remind you that they can also use the opportunity to integrate other health services into their visit without overworking them. In our setting, we provided training for community health workers on reproductive, maternal, newborn child, and adolescent health messaging to ensure that women, adolescent girls, and their families continue to have information on where and how to access routine, essential, and emergency services. For example, this included information about available contraceptive services, sexually transmitted infection treatment services, and antiretroviral therapy clinics for HIV-positive patients. In some cases, when access to facilities was very limited, we trained community health workers and other reproductive health outreach workers to distribute medications and supplies to women and adolescent girls self-isolating at the household level. During the home visits, the community health workers are equipped to provide basic emotional support through psychological first aid to the affected people, or in some cases, deliver psychosocial support kits and mental health and psychosocial support messages. They also make sure that they provide the relevant information for mental health referrals for the affected people, including hotline or helpline numbers and community-based mental health and psychosocial support focal points.
Oh, thanks, Alice. And can you tell us what you would do if the patient discloses a gender-based violence concern? Which other sectors would you engage in the care for the patient, and how would you do it?
That's a good question, Emma, and a great way to illustrate how the integrated framework can be helpful in programming. Of course, from the health perspective, we provided training for community health workers on messaging for cases. In some situations, the community health workers will refer to health facilities so that the woman could access appropriate clinical care, such as post-exposure prophylaxis for HIV and emergency contraception. In other settings, when access to health facilities was very limited, we trained the community health workers to provide the necessary medications directly so that women did not miss out on essential services. Once the woman has received the necessary clinical care, it is important to refer to protection actors and provide further referral for the mental health and psychosocial support.
Alice, this framework sounds brilliant and like it's going to be really useful. Thank you.